चलो इसी के हिसाब से ठीक है।
सांस लो, no response to anti-tubercular treatment. So that means that we may be dealing with some kind of primary resistance or maybe multi-drug resistant tuberculosis. So send test for resistance testing.
Complicated tuberculosis like multi-drug resistant tuberculosis, extensive drug resistant tuberculosis, and what to talk of these now, total drug resistant tuberculosis, they are also coming up. So I think the scenario is desperate.
का मिनिमम 24 मंथ्स का जो है ड्यूरेशन है, उन ड्यूरेशन में पेशेंट को वो मेडिसिन टॉलरेट करना बहुत ही मुश्किल होता है। जो पेशेंट का ट्रीटमेंट एडहेरेंस है वो बहुत कम हो पाता है ड्यू टू इट्स साइड इफेक्ट।
Sir, we have not been able to control 2 to 3 such cases. So what is to be done in these cases?
We treat with whatever we have. The prevalence is that it's around 1 to 3% in new patients, and it's around 15% in the previously treated patients. And one patient before getting well usually infects 10 or more persons in a year, and 40 to 50% of HIV patients develop tuberculosis in due course. If there is resistance to one drug, we call it single drug resistance, and if the resistance is to 2 drugs, which are the main ones, INH and rifampicin, we call it multi-drug resistance. And also there is a situation where there is extensive drug resistant tuberculosis, where the resistance is to more than 2, that means 3 or even more drugs. More effective treatment and more effective treatment and social changes and education, they can go hand in hand.
Do we have any hope if this patient tests positive for MDR-TB?
The treatment gets prolonged, the drugs become less efficacious, and the cost also rises. Ask me, can we at all control tuberculosis? My answer would be yes, we can. The first is that we have to educate our people regarding the complete and regular treatment. Vaccination cover has to be complete. Longer is the duration of treatment, there are more chance of irregularity and the resistance developing. Suppose we have a situation where we have a drug which is given for just 1 month, the chances are that we will succeed in controlling it.
अगर ये बहुत ही अच्छा हो, अगर कोई नई दवा इसमें मिल जाए जिसका कंपैरेटिवली ड्यूरेशन भी शॉर्ट हो, जिसकी टॉक्सिसिटी भी कम हो, तो ये टीबी के पेशेंट के लिए निश्चित तौर से वरदान साबित हो।
And as far as the new regimen, yes, this is the high time when we are facing a lot of total drug resistance. So this is the high time when we require. We have expectations also. We pray to the God also that a new drug should come.
The scientists are working all over the world on effective new drugs and new drug regimens. We will succeed one day.
Doctor called last night for that multi-drug resistant patient.
What happened?
That patient, he expired, cardiac complications. We tried our level best and we tried everything almost, but we couldn't save him.
Last week also we had a similar patient and we could not save. We need new and effective drug, kind of a wonder drug.